Okay, a very good morning, all of you. So today's live session will focus on the following case-based question, and we'll discuss some related questions, and also I have some homework questions for you, right? So before I proceed, I have the following message for you. हर उड़ान से पहले गिरना जरूरी है. I'll repeat. हर उड़ान से पहले और पहले गिरना जरूरी है. Right? So let's start our wonderful live session, wonderful day with this wonderful quote. Right? So, as we can see, this is the context. A patient seeks help for recurrent palatal pain. She presents with multiple punctate ulcers in hard palate that were preceded by tiny ulcers. Her lesions typically heal in about 7 to 10 days or 1 to 2 weeks' time and reappear during stressful times. So, if you closely observe, we have some keywords in this particular question or context. So, you can see tiny ulcers, consider that as a keyword. You can see reappearance, consider that as a keyword. And you can see lesions on palate, so consider that clinical location as another keyword. So try to identify keywords whenever you're going through any question. I mean, with practice, you can do it very fast. Okay. So now I sound funny in Hindi. That's fine. I'm improving. So now give me the context. So patient seeks help for recurrent palatal pain who presents with multiple punctate ulcers in hard palate that were preceded by tiny ulcers. Her lesions typically heal in about 1 to 2 weeks' time and reappear during stressful situations. So that can be considered as a keyword. So the patient has, what do you think? After ulcers, a recurrent primary herpes, recurrent secondary herpes, erythema multiforme. So which one do you think is more appropriate answer? So I've given you some keywords, you should be able to answer. You might think it is after ulcers, but we'll get back to that. We have one related question pertaining to the same. Yeah. So is it primary herpes or secondary herpes? So we're talking about palatal pain, which is adherent. The mucosa there is adherent to underlying periosteum. And also we're talking about recurrence, and we're talking about healing within a span of 1 to 2 weeks, and then reappearance. Okay, well tried. So, given the clinical scenario, I'll show you some pictures and then you can give me the answer once again, right? So, so as you can see in the following clinical pictures, so can you identify what this is? You can see multiple tiny lesions in this area. So they are basically vesicles. You can see brown crusting. But in this case, you can see vesicles which are grayish or whitish in color, almost 1 mm or less than 1 mm in diameter, occurring in multiple manner, and you can see coalescence as well. And once healing happens, you can see brown crusting too. So as you rightly mentioned, this is a case of herpes labialis, right? Very good. So it can also happen, the herpes infection can also happen within the oral cavity, and we call that as intraoral herpes, right? So the given context is a classical case of recurrent secondary or recurrent or secondary herpes. So where you can see specifically lesions on the mucosa which is adherent to periosteum. So as you can see, so even it doesn't appear grayish or whitish in color, upon healing, you can see red ulceration and also reddish halo, which is a classical picture of recurrent herpes intraorally. No, some of you is one of you is asking about scars. The characteristic feature here is they heal without scars. No literature as well. So, as you rightly mentioned, it's a case of recurrent herpes, recurrent or secondary herpes. Okay. Now, let's move on to the related question. I hope you've seen the images. In which of the following herpes infections circulating antibodies are not evident? Primary, recurrent, both, none of the above. Good. As we have discussed about the pictures, they are case of herpes labialis. So recurrent infections can occur on lips, herpes labialis, or within the oral cavity, right? As we have seen on palate. Also, the characteristic feature, which I'll be discussing in the next question, consider that very important. The location of lesions based on the nature of mucosa. Okay, so, in which of the following herpes infections circulating antibodies are not evident? So, it's obvious that only when you have some infection, there can be development of resistance in the form of antibodies, humoral mediated immunity. So, obviously, in primary infections, we don't find antibodies. Wonderful. Only in case of secondary or recurrent infections, we find antibodies, and it's clearly mentioned that. And it's quite interesting to know that depending upon the socioeconomic status, the circulating antibodies are present accordingly. And it has been reported that around 80 to 100% of those who are in lower socioeconomic status have these circulating antibodies, whereas 30 to 50%, only 30 to 50% of upper socioeconomic status individuals, including medical, dental, and nursing professions, do have these circulating antibodies, right? So consider this very, very important. So there is a relation between presence of circulating antibodies with respect to a person's socioeconomic status, which is uh, obvious and quite interesting, right? So as you rightly mentioned, which of the following doesn't have circulating antibodies? This primary infection, right? Now, let's move on to the next question. Recurrent intraoral herpetic lesions can be differentiated from recurrent after stomatitis in that the later are exclusively found on mobile mucosa, mucosa bound tightly on the periosteum, both none. So those who have chosen option A in this particular context, you'll have more clarity now. So I'll repeat the question. Recurrent intraoral herpetic lesions can be differentiated from recurrent after stomatitis in that the later, in the sense, the recurrent after stomatitis. Former means the previous one, later means the later part of the question. The later are exclusively found on mobile mucosa, mucosa tightly bound on the periosteum, both and none. So, as most of you rightly mentioned, it is mobile mucosa, and this is a differentiating feature. Remember, in case of recurrent intraoral herpetic lesions, they are exclusively or mostly found on mucosa which is tightly bound to periosteum, such as hard palate, and also you have seen a clinical image, also gingiva, attached gingiva, as well as the mucosa covering the alveolar ridge. So these lesions are found mostly on mucosa, which is adherent to the periosteum. Seldom or rarely they are found on mobile mucosa, but in immunocompromised patients such as AIDS, which is an exception. And most importantly, as you all rightly mentioned, rigorous after stomatitis is found on mobile mucosa, exclusively found on mobile mucosa, right? I hope it's clear. Well done. Now let's move on to the penultimate question. As you know, we have various drugs which are indicated for providing symptomatic relief in case of herpes infections, right? So acyclovir is one such drug. Now, coming to acyclovir, which is an antiviral drug, which is active against herpes group of viruses, which we discussed in one of the assignments as well, the order in which, on whom or on which viruses it is more effective. So this acyclovir is an active drug form, a prodrug, an active metabolite, or an active form. So which of the following words is more appropriate to describe acyclovir? So I'll repeat the question. Acyclovir, which is used for obtaining or achieving symptomatic relief, right, is active drug, prodrug, active metabolite, active form. Okay, let me give you a hint. It's not option A. It's not active drug form. Jaydev Solanki says prodrug. Okay, let me give you another hit. It's not active metabolite as well. So you're left with two options, B and D. So no one wants to choose option D. Okay, let me give you another hint. It's not option D, so which makes it option B. So acyclovir is a prodrug. It's an inactive form. What is active form? Can anyone tell me what's the active form of acyclovir? Acyclovir active form. Okay, consider that as your homework question. But remember, as you know, a prodrug is an inactive form of drug which has to be converted into an active form for desired therapeutic action. So, what about active drug form? So, prodrug gets converted into an active form or active drug form. So, active form, active metabolite, these are all the same. Okay. So, let me give you another example. Codeine. You might have heard of the name, a drug name codeine. Codeine is, so which one do you think is more appropriate among these options to describe codeine? Yeah, acyclovir is a prodrug. Acyclovir triphosphate is an active form. When I say codeine, which of the following words or keywords aptly describe codeine? Good, Hari Krishna. Acyclovir triphosphate. Very good. Yeah. Codeine is an active drug, right? Codeine is an active drug. Morphine is its active metabolite. So, active drugs sometimes they're slightly modified for desired therapeutic action within the body. So that leads to formation of active metabolite. So best example I can give you is codeine, active drug, and morphine is an active metabolite. Okay, I hope it's clear. So try to have clarity on all these terms and remember, active form or active metabolite, they mean the same, right? I hope it's clear. Now let's move on to the final question. In next appointment, not in the same appointment, in next appointment, you're planning some aesthetic procedures for this particular patient, and the following is the question: rubber dam is best indicated for adhesive procedures, difficult patients, complex procedures, finishing and polishing of that adhesive restoration or aesthetic restoration. So, which one do you think is more appropriate answer? Very good. So, most of you say adhesive procedures, very impressive. And some of you say finishing and polishing. Do you need rubber dam for finishing and polishing? Priya says option C, complex procedures. Because it's complex, you want to complicate it further by placing a rubber dam. No one is choosing option B, difficult patients. Because the patient is already difficult, you don't want to further complicate it, right? Okay, well done. But let me state this. It has to be clear for you right at the undergraduate level itself. A rubber dam is mandatory for all clinical procedures. Take my word, right? So it's A, B, C, D. Irrespective of the procedure, it can be a simple restoration or a complex restoration. It can be a simple procedure or complex procedure. It can be beginning of procedure or finishing of procedure. All procedures have to be done using a rubber dam, right? SC Barnum has given us this great opportunity to use these sheets in order to have enhanced access, visibility, and most importantly, infection control, which is the need of the hour. In fact, we were discussing about one of this in recent study club discussions. You need not worry about clinical practice provided you are facing this pandemic. Infection control measures have to be taken, and rubber dam can be rubber dam has to be incorporated in everyone's practice. You know what's difficult with using rubber dam? The most difficult thing about rubber dam is convincing the dentist to use it. That's it. But the procedure as such, placing rubber dam, it hardly takes 2 to 3 minutes. Hardly 2 to 3 minutes, right? So in post graduation, it was mandatory for us and for most of the students to use rubber dam. Once you get used to it, you'll start enjoying it, and you'll feel some lacuna if you actually don't use it while performing any procedure, right? I hope it's clear. So A, B, C, D. ABC. In India, it's not used. No, it's used. Just because many private practitioners are not using doesn't mean that no one is using. But it's true that most of them don't prefer using rubber dam, but it has to be used. I mean, you can be the change makers, right? Okay, we have to. So we should not complain. But see, you know the facts, right? Now you can start using, and you can be the change you want to see in this world, in our country. Okay, right. So before I conclude, I have the following homework questions for you. So before I post these homework questions, I'll try to summarize all that we have discussed so far. I have three homework questions for you, and before I proceed with them. So we've discussed the context, patient complaints of palatal pain. So it's a mucosa which is tightly adherent to the underlying periosteum, punctate ulcers preceded by tiny ulcers, and then lesions typically heal in about 1 to 2 weeks time and reappear during stressful times. She has so secondary or recurrent herpes infections. And in which of the following conditions circulating antibodies are present or not present? In case of primary infections, circulating antibodies are not present. If circulating antibodies are present, it indicates recurrent or secondary infection. Also, based on socioeconomic status, it's clearly mentioned that those in lower socioeconomic status have greater circulating antibodies. And remember, having antibodies is good, right? Because it is a form of defense mechanism, right? Unfortunately, higher socioeconomic status individuals have a lesser incidence of having these circulating antibodies, hence are more prone for infections, especially dental profession, medical profession, nursing profession, right? Okay, now let's move on to next one. Also, we discussed about the location in specific. So, after stomatitis, recurrent after stomatitis are almost exclusively found on mobile mucosa. What about recurrent intraoral herpetic lesions on mucosa, which is tightly adherent to periosteum? Rarely or seldom on mobile mucosa, as in case of AIDS patients, right? Now, acyclovir, which is used for obtaining some relief, so is a prodrug. Acyclovir triphosphate, as Hari Krishna rightly mentioned, is the active form or active metabolite, right? And then finally, we were discussing to incorporate rubber dam. I had to put this question. So, planning aesthetic procedure. So, rubber dam is indicated in which of the following situations? All of them. All of them, right? I hope it's clear. Now, let me give you some questions because last time I had difficulty in retrieving a third question. So this time I decided to note down all the questions so that I won't miss them. I won't miss torturing you. So first homework question is drugs used to treat secondary or recurrent herpetic stomatitis apart from acyclovir. So can you name any other drugs which can be used? So do get back through mail. Homework questions you can get back through mail. Okay. And second question is, can we differentiate? Consider this very important. Can we differentiate primary and secondary herpetic infections based on histologic features? Second question. So, based on histopathology, based on histologic examination, can we differentiate primary herpes infection from secondary herpes infection, right? Third question. Let's see how many of you are going to take it. It has been shown that most adults have circulating antibodies in blood, but never exhibited severe primary illness. Can you explain why? I'll repeat this question. As we know, in case of primary infection, there are no circulating antibodies. In case of secondary, we do have circulating antibodies, which is obvious. But studies have shown that most adults have circulating antibodies in blood, but never exhibited severe primary illness. See, when they have circulating antibodies, it's understood that they had secondary or recurrent infection, but they never exhibited severe primary illness. How do you explain this? So these are some of your homework questions. I thought it would be much more interesting if I incorporate them, and it would just extend that discussion beyond this live session, right? So I hope it's clear, and I hope you enjoyed today's session. And I must say, we are lucky to have uninterrupted power. So thank nature. Okay, guys. So tomorrow is Sunday. Do you want a session, a general session? Because again, from Monday to Saturday, we'll have our regular case-based discussions and in different formats possible. I'll try other formats as well, but we'll have one live session every day from Monday to Saturday. What about tomorrow? Do let me know. Tomorrow is Sunday. In lockdown, it doesn't make much difference between Sunday or Monday or Saturday, right? Every day is almost the same. Okay, right. We'll do one thing. I see some keywords. Yeah. Why not a general session? We'll definitely have a general session, right? And before I conclude, I'll read out the message once again for you. I'll tell you why I'm giving this message. हर उड़ना हर उड़ना से sorry हर उड़ान से पहले गिरना जरूरी है. See, often we come across many challenges. It doesn't mean that we have to give up. When you're facing any challenge, I frankly believe from the bottom of my heart that every challenge is an opportunity. I'll give you a small example. Yesterday's live session, we couldn't really conduct a live session because of power issues. I tried mobile data, but still the mobile, because of I was sitting outside due to lack of light indoor. So because of excessive heat, the temperature spiked and even mobile phone switched off. It said it had to cool down. So, in spite of those challenges, we tried our best, but we couldn't somehow do it. So we tried some other alternatives. But if you consider that only as a problem, you will just keep complaining, which will only add to your negativity and stress. But rather, I found one wonderful, amazing tip yesterday which no one ever told me. I don't know why, no one ever told me. But yesterday we found out that using these earphones and connecting that with the live device would actually enhance the audio output. I've been doing hundreds of live sessions. I've been telling my parents the same. I've been telling others the same. But somehow we couldn't do it. But yesterday's challenge gave us an opportunity, gave me an opportunity to improve the audio quality. Isn't that wonderful? So that's the reason why I wanted to give out this message in Hindi. I've been trying to learn several languages, and Hindi is definitely one of my favorite languages. So, हर उड़ान से पहले गिरना जरूरी है. It's okay to fall down. It's okay to fall. It's okay to face challenges, but ultimately, it's for our progress, isn't it? So I'll see you again tomorrow at 10:30 a.m. Indian Standard Time. We'll have lots of fun. Take care. Have a nice day. Bye.